Welcome to the latest episode of Exploring Health with Cleveland Clinic London. Thank you to Cleveland Clinic Philanthropy UK for supporting this podcast. I'm your host, Kash Akhtar, a consultant orthopedic knee surgeon. Today's episode is about heart health in the digital age and how wearable technology is changing the way we detect, monitor, and prevent serious cardiac problems. We'll be discussing how wearable devices can support early detection of heart conditions, where they help and where they can mislead, how digital health fits into real-world clinical care, and learn more about Cleveland Clinic London's approach to cutting-edge heart care. So if you ever used a smartwatch or fitness tracker, worried about palpitations, fitness, or family history, or if you're a GP, physio, coach, or just simply health curious, this episode will give you clarity and the answers you need. Joining me today are two outstanding experts from Cleveland Clinic London, Professor Sanjay Sharma, an internationally recognized cardiologist and a world authority on sports cardiology and sudden cardiac death, deeply involved in athlete screening and prevention, and Dr Matt Wright, consultant cardiologist and electrophysiologist, who specializes in heart rhythm disorders, monitoring, and digital diagnostics, at the forefront of integrating wearable data into clinical decision-making. Together, we'll explore how digital tools are reshaping heart care and what people actually need to know to use them safely and intelligently. So thank you both for coming.
Pleasure.
Let's start with the big picture. Matt, what are the common cardiovascular risks that we see today?
Well, I guess the commonest cardiovascular risk will be coronary artery disease, which is where you get furring up of the heart arteries. And cardiovascular sort of disease accounts for 30% of all deaths. So cardiovascular disease is important. Obviously, what I deal with are rhythm disturbances, where the heart's beating irregularly or sometimes very fast, other times very slow. And again, this is a very common cause, not only of death, but also of feeling unwell. So that's what I'm predominantly dealing with. And this fits very well with smartwatch detection. So it's very easy to record an ECG. That's a heart rhythm trace. Your Apple Watches, Garmin smartwatches, there's various devices that can tell people what rhythm they're in and if the rhythm's abnormal. And then in terms of general cardiovascular risk, you could look at devices which are measuring your blood pressure based on various algorithms, because they're often not the same way that we would record blood pressure. And it's important to know the sort of technical details to know what's good and what's potentially not as good with the devices, because we're getting a lot of data, and data is good. It democratizes healthcare. It puts it in the hands of people. And I think one of the important things that should be drawn out in this sort of conversation is that when people buy smartwatches or any of these sort of consumer devices, they are people. Obviously, as doctors, we're used to dealing with patients.
Yeah.
And it's very important, I think, to have a very clear distinction of when we're having, what I say to patients or people is we're going to have a discussion. We're applying sort of our knowledge to try and explain the data, rather than someone coming with a condition where they say they feel unwell, they feel breathless, they're going, my heart's going too fast.
I'm with you, yeah.
So I think it's really important that we keep these things separate.
Thank you. Sanjay, how much difference does awareness and early detection really make?
I think it's very important, just as we started off by saying that cardiovascular disease takes 30% of the human life in the UK, about 7.6 million people. And of course, we know that heart attacks are the most common cause, but around 70% of these the causes are modifiable. So things like high blood pressure, diabetes, high cholesterol, smoking. And we've been very good at bringing down the incidence of cardiovascular disease until more recently, where things have stagnated a little bit. And indeed, since 2024, the incidence of cardiovascular disease is going up. So awareness is very important. There are big charitable organizations that are talking about how we can actually look after ourselves to actually prevent ourselves from having a heart attack. And I think in this respect, wearable devices are very good. They give you an idea of the amount of physical activity you're performing. They provide data on heart rate variability, which may be affected by sleep or stress. They give you some idea of your vascular age, which may raise suspicion that someone may have an underlying high blood pressure or high cholesterolemia. Both of these conditions, as you know, are silent killers, so people don't know they're actually carrying them. So I think in that respect, these gadgets allow people to detect things early, allow them to be in charge of their own health and prevention of cardiac disease.
And it's fascinating. You mentioned vascular age. It's not a metric that I'd ever come across, but my scales, smart scales, give it to me every day. And I'm like, oh, okay. So and so that's another metric that we're looking at nowadays.
I think so. I mean, I think, you can't really tell from much non-invasive technology that's available to everyone at their fingertips about what your vascular age is like. You'd have to go and see an expert, and they'd have to do various tests. But some of these wearable devices, from in your digital arteries or your radial artery, can give you some idea of your vascular age, of how stiff your vessels have become with age.
Right.
Or with underlying risk factors. I mean, I get quite worried because I always consider myself as quite fit because I run quite a lot. And whenever I go to David Lloyd, it tells me I'm about 15 years younger than I should be, and I get very, very excited.
Yeah.
But when I look at my Aura ring, it tells me my vascular age is only a year less than my real age.
Yeah. And that's one of the challenges we're going to discuss shortly, is trying to make sense of that data. Heart risk, how does it differ between the general population, recreational exercisers, and elite athletes?
Good question. There's no doubt that exercise is probably the best medicine that's ever been invented. I don't think, certainly for the next century, we'll have ever invented anything that gives you better rewards than exercise does. I mean, the important thing is that exercise is cheap, it's free, it can be done at any time, and you're in control of when you do it. And it's devoid of some of these undesirable effects of some of the medical therapies we implement, such as drugs. And there's overwhelming evidence that people who exercise moderately actually reduce their risk of having a heart attack by about 50% in their 60s and 70s and live between 3 to 5 years longer than sedentary people. Now, to do this, you don't have to be a marathon runner or a top triathlete. You've just got to be someone who does a moderate amount of exercise on a regular basis every week.
And it's interesting because the thing that's been a lot of people used to talk about VO2 max training and, going all out as fast as they can. And increasingly, particularly on social media, there's been a lot of talk about zone 2 cardio. What's your thoughts on zone 2 cardio? Does that count? Would that as an exercise that's going to extend your lifespan?
I believe so. Well, zone 2 would be moderate intensity exercise. And the good thing about exercising at zone 2 is that most people can do it talking, or maybe coming up for air every now and then.
Yeah.
And it's not something that is over in 15 or 20 minutes. You can do it for 30 minutes, 40 minutes, 50 minutes. In fact, if we look at all our top endurance athletes, including people like the likes of the Brownie brothers, who were so amazing at the triathlon.
Yeah.
I mean, they spend so much of their time in zone 2, and they only push up to zone 4, 5. 30% of their training. So it's very, very good for improving endurance and increasing maximal oxygen consumption. The only thing is that if we get too drawn in with this zone 2, zone 3, then people get slightly worried because everyone's different.
Yeah.
As you know, maximal heart rates vary from one person to another. We've got this very crude equation, the Astrand equation, 220 minus your age. That gets less and less applicable as you become older. And similarly, exercising in zone 2 becomes more and more difficult as you become older. So people keep staring at their watches thinking, I've gone above 115, I'm going way too fast, I need to go much slower.
Yeah.
So I think there are some limitations to using smartwatches for zone 2.
Yeah. And a lot of people use the rough rule of thumb that if you're able to maintain a conversation whilst exercising, that's usually zone 2.
Correct, I would say so.
Matt, wearables are everywhere now. But there's a wealth of information that comes out there. And then metrics such as strain, such as heart rate variability, things that a lot of people aren't familiar with. And so I think there is a sense of overwhelm with that data. I mean, you're an expert, it's what you do. But I think for a lot of people, it still can be quite a challenge to really understand what the data means and to then act upon it.
These devices are really useful. The data is fantastic. What the difficulty is who's interpreting the data. And they've all got pros and cons, it's how do you compare that to a medical device? But, I've been able to make diagnoses on airplanes by asking for an Apple Watch, in Fortnum and Mason's when someone collapsed, with my dad
Right.
after I bought
Yeah.
a Cardia. My son said, let's test Grandad. And we did test Grandad, and then he's ended up with a pacemaker. So the thing that I always say, because people often come and go, no, I've got this device and it says this, but they're no good. And you're like, no, they're very good. I think this is one of the sort of fundamental questions, and perhaps, I don't want to say a problem, I just think it's a question. Because in screening, in medicine, we have had rules about screening, for 70 years or so. Is it an important disease? What's the natural history? Can we alter it with treatment?
Yeah.
Is there a pathway? And so we have very strict rules about screening programs. Whereas with these devices, you're putting them in the hands of millions of people. And even a very accurate test is going to generate anxiety, false positives, because of the sheer vast quantity of people who've got one of these. Also, with a screening program, we would look at which population of patients we're going to screen. We wouldn't go, let's screen for prostate cancer, let's screen all men, for example. You'd sift the data.
Yeah.
Whereas there's none of that when people can just buy a device. And it's really putting into context the information or the data with that person.
Yeah.
So, if Sanjay, sees a footballer who has a rhythm disturbance, let's say they get some AF, okay? A young, fit, healthy person with some AF is going to make us interested. But we're going to treat that person very differently to, say, a 70-year-old who's got the same amount of AF on a device, because they're completely different people.
So the risk stratification is very different.
Yeah.
When you start talking about screening tests, it really gave me flashbacks and palpitations to med school. And I was thinking about type 1 errors and type 2 errors and all sorts of things I've long forgotten. Can you tell me, with these wearables, what can they do well and what can't they do?
So I think the sensors and the data is very good. So they can, create the primary data really, really well. What they fall down upon, and I don't even want to say fall down, but what they're perhaps a little less good is the diagnostic accuracy. Because they are set up with very different sort of ways of what they're trying to achieve. They don't want to be wrong. So, which is very different from trying to be right. So
the sieve is the net is cast slightly wider.
Yeah. So, for example, they may say unclassified or possible AF, and we could look at the data. And you look at the data and you go, no, that's not atrial fibrillation, that's atrial ectopics, or it's ventricular ectopics. And it's very easy to see. They might go high heart rate, and we would go, that's a sinus tachycardia. Or we might go, actually, that's an atrial tachycardia. And we're going to treat all of these very differently. However, the device isn't telling you about these things. It's just sort of saying, that's what it is, go and see someone.
Yeah.
And there's a chance that you're going to create anxiety. It's sort of like, if you've got a fire alarm, it can detect smoke. Okay? It's very good at detecting smoke. But you are put in the context like, oh, there is a fire, or I'm burning toast.
Yeah, great analogy.
And that's what, as doctors, we're doing. Like, we can interpret the data. And I think that's important to be aware of.
When it comes to wrist trackers, smart rings and chest trackers, is there one that's much better than the others?
So there was a study in one of our journals, Journal of American College of Cardiology, where they looked at a variety of devices, and by and large, they're all pretty similar. Like some are perhaps a little better than others, Like the Apple Watch is FDA approved, for example, and can be used and is being used in clinical trials to look at how we manage atrial fibrillation, how we decide should we anticoagulate or not. So, I think some brands are very heavily involved in becoming effectively a health device.
Sanjay, can I ask you, these blood pressure recordings from a wearable, how accurate, how reliable is that?
They're good. They use photoplethysmography to give you a blood pressure
The
reading.
PPG.
Yeah.
I finally got it. Thank you.
So they're very good for people who've got white coat hypertension, for example. Someone comes in to see you with white coat hypertension, and you put a 24-hour ambulatory blood pressure monitor on them, and it's keeping them awake. It's inflating. The cuff's getting inflated every hour.
Yeah.
They're not sleeping properly. They're tense, and you may get a satisfactory reading in people who are carefree, but you may still get odd readings in people who are very concerned. In that case, something like a wearable strap measures your blood pressure every hour, and it gives you a 24-hour blood pressure reading as well. So you get a very good idea of your 24-hour blood pressure control. And as Matt said, you get some idea of the triggers, the sort of things that make you have a high blood pressure, either if you've not slept properly the night before, if you've consumed more alcohol than you should have done, more caffeine, or there are certain points at work where you're having a lot of stress. We normally ask people to check their blood pressures first thing in the morning. That's usually probably the best time, because that's the time where your get up and go hormones are sky high, your cortisol levels are high. So you're probably going to get the best readings in the morning. So we normally ask for 3 readings. But if you're wearing one of these monitors, it gives you a trend of what your blood pressure is doing.
Yeah.
They're good, but there are issues with photoplethysmography. They don't work as well in dark-skinned individuals. They don't work well if you've got lots of tattoos over your wrist or something like that. So there are a few issues there as well, depending whether your radial pulse is, whether you've got an aberrant radial artery. So there are some limitations there, but I prescribe them a lot in people who are worried about their blood pressure. It allows us to get a much better guide on what's actually going on, and also to titrate medications.
Yeah. And when you prescribe them, you're prescribing a particular medical device?
No, I do prescribe a device. Clearly, probably for the sake of commercialism, I shouldn't probably mention it. But there are plenty of good wristbands that can be used. They start off with free. You get a free trial for about a month, and I think then you've got to pay a small amount each month to help maintain your blood pressure. But I think what I love about it is that you are completely in control of your blood pressure.
Yeah.
You know what's going on. But again, that really does rely, these wearables rely heavily on motivation as well. The motivation of people and the amount they take note of them. I can tell you my own story. My Oura Ring told me everything I already knew, but I didn't want to know about it. For example, I don't sleep enough.
Yeah.
I eat very late.
Yeah.
And
I think that's
morning,
what the Whoop did to me as well.
Every morning it would tell you, by the way, your ready score is 70%.
Yeah.
Because your heart rate didn't go down to below normal until about 4 a.m.
Yeah.
Assuming you probably consumed alcohol last night or ate late. Of course, I knew the answers. Or your sleep, you've only slept 4.5 hours tonight.
Yeah.
And in the end, it gets you quite worked up. Now,
and it's quite challenging because you've got a thing that's saying you're not in your best, and you're like, well, I've got to go and perform today either way. I don't have a choice.
But what it did, it certainly made sure that my behaviour changed.
Yes.
For a little while. I've stopped wearing it now, but I probably will start again. I started coming home a bit earlier. I started eating immediately when I got home.
Going to bed early.
Exactly. And I knew that if I consumed alcohol, that HRV was going to be off the scale. It made me, monitor my alcohol consumption, monitor how much I was sleeping. So I really took notice of sleep hygiene, eating early. So, and that was me being a doctor, knowing all these things anyway.
Yeah.
But so if you've got someone who's very motivated, who's got a strong family history of premature cardiovascular disease, I think these devices are excellent for people like that.
And can I ask, you mentioned HRV a couple of times, heart rate variability. Can you just explain what it is and what its significance is?
So heart rate variability is the gap between what happens to your heartbeats when you take a breath in and when you take a breath out. So when you breathe in, your heartbeat speeds up because obviously your heart's filling with blood, so your heart beats a bit faster. When you breathe out, your heart beats a bit slow. And it's the difference between the gap between those heartbeats during a breath in and a breath out. And generally, people who are very fit have a bigger gap compared to people who are not fit. The problem with heart rate variability measurements is that it's almost as if one size fits all. They say that a normal range should be between X and Y. And that's another situation where some of these wearables can cause a lot of anxiety. I always tell patients that your heart rate variability is your own measure. You use that as your guide. And if that's going down, then there's an issue, and I'll come to that in a moment. If it's going up, then that's a good thing.
You're getting fitter.
Yes. So obviously it will go down if you're not sleeping properly, if you're under a considerable amount of stress, if you're consuming excess coffee, if you're consuming excess alcohol. All sorts of things can make it go down. But there are lots of things that can make it go up. Good sleep, reducing some of these caffeinated agent stresses, and exercising. So that's what we use it for. Obviously, athletic coaches use it a lot. They normally use it for behavioral reasons, sleep and allowing enough time for recovery. So it's used a lot in the athletic world, the HRV.
How does data from these devices support early detection and preventative care?
Well, there are plenty of reasons. Let me give you an example. Someone says, my heart is constantly 105 beats per minute. And I understand that's not normal. Now, that may be a sign of an anemic patient, or someone whose thyroid is overactive, or someone who's actually got something wrong with their heart, a leaky valve or poor cardiac function. So I think in that respect, it's very good. Very, very good for oxygen saturations dropping at night. People don't realize they've got obstructive sleep apnea unless they've got someone sleeping next to them and telling them that they're snoring very loud and they stop breathing in the middle of the night. Yet they wake up exhausted. So I think oxygen saturation is going down significantly at night, a persistently elevated heart rate, and very good at detecting asymptomatic atrial fibrillation as well. There are many people that come to see me saying that my watch tell me I've got atrial fibrillation. You look at the trace and sure enough it is. And some of these people have got CHAS-VAS scores of 2+. So it's good for that. So I think very good for atrial fibrillation, very good for obstructive sleep apnea, for sure. In sport, of course, we look after athletes who say, look, I get symptoms, but they don't happen all the time. And they'll come and see you. You'll do an ECG, you'll do an echo, you'll do an exercise test, and you put a Zio patch on, and you find nothing. That doesn't mean there's nothing wrong. It just means that that's the time they didn't get any symptoms.
Yeah, you didn't catch it.
Yeah. So then they'll tell you, I only get it if I make a sudden turn on the ball or if I'm diving to the right. And that's where things like the Fourth Frontier heart rhythm monitoring device helped me so much. It's helped us detect supraventricular tachycardias.
And that's something they're wearing during training, during playing?
Yes, absolutely. Right. So we use it for that. We use it a lot for that. And as you know, there are several very good football players that are now playing in our league with serious heart rhythm conditions that have either been ablated or they've got defibrillators in situ. But still, even although defibrillators are amazing, they're life-saving, sometimes we gauge what that ongoing risk is for a shock. And even those people wearing those devices, sending them back to a specialist to look to see what their ectopic burden is, to see if they're getting ectopic very close to each other, with short coupling intervals that could promote VT or ventricular fibrillation. That's very useful information, because if you were getting athletes that were getting something like that, then obviously I'd enlist the help of someone like Matt, say, we may need to do an ablation here to prevent this ICD going off again and again and again.
And it's interesting, when you think of like the most high-profile medical emergencies that have happened in football over the last few years, one thinks of Fabrice Muamba, one thinks of Christian Eriksen, one thinks of these sudden cardiac events. They are heart-related, aren't they?
Absolutely. Before I say any more, I said exercise is amazing. We should all be doing it. Even people with heart disease should be doing it. We know it's got massive benefits. But it is true that there is an exercise paradox, that some people may sustain a myocardial infarction during exercise, or may even die during exercise from a fatal arrhythmia. We know that your risk of having a heart attack is about 7 times greater during exercise than at any stage, at any time of your life. And your risk of dropping dead suddenly is 17 times greater during exercise than at any other time in your life. But most people that succumb to these things actually have an underlying cardiac problem. And what exercise does it unmasks the condition.
Yeah.
The adrenergic surges and all the other metabolic stresses that go with exercise can sometimes promote ventricular fibrillation in an active individual that may not have occurred in a sedentary person.
And some of those active individuals, you look at the professional athletes, they've been performing for 1 or 2 decades at the highest level, and then all of a sudden it just happens.
I think that's the thing that's failed us all. We don't know, what's the straw that broke the camel's back on February the 12th, 2025, versus the 15 years that this individual's played.
Yeah.
If you look at someone like Christian Eriksen, why did it happen that day? And why had it not happened in the 11 years he played in our Premier League? And why has it not happened since?
Yeah.
So, it's a combination of lots of things that promote ventricular fibrillation. We can speculate, hydration status, acid-base disturbance, the core temperature, the amount of circulating catecholamines. We don't know exactly what causes it, but something related to exercise can bring it on.
Thank you. Matt, let's move on to how cardiologists use data from wearables in real-world practice. When is wearable data genuinely helpful?
I think it's always helpful.
Okay.
There was data, it's probably quite old data now, but I think it took 7 years to make a diagnosis for an SVT in ladies, not that long ago. And they were often classified as being anxious or hysterical. Because, if you're having an attack of an SVT once every 2 or 3 months, the chances of you capturing that on any device, unless it's there all the time, are minimal. Whereas now, one of the first things I'm doing when someone walks in the room is I'm clocking, do you have a wearable?
Yeah.
And, they start talking, and then I'll say, can I have your phone?
Yeah.
I'm a Tottenham Hotspur supporter, and I was
I'm sorry to hear that.
yeah, well... But I was at the stadium and I got talking to someone. They had palpitations. I clocked they had a Fitbit. Sounds like you've got atrial fibrillation. And she actually goes, oh, that's quite interesting. That's what this thing says.
Yeah.
And I'm like, yeah, well, I'd agree. We got the phone, got the trace.
Yeah.
And I actually made a slide of Tottenham and I use it in talks. And I say, this is my outpatient clinic.
Yeah.
So
are you seeing there's a lot of palpitations at Tottenham Hotspur
There's a
Stadium?
lot of palpitations.
A lot
especially this season.
I'm surprised there haven't been so many cardiac arrests.
Yeah. So it's one of the first things that I look for.
Yeah.
Because, of course, I have access to every single monitor I could care for. But the one that you have on your wrist or on your finger is often the most useful. It's a bit like, what's the most useful camera you have? Is it like your Nikon SLR?
It's the one in your pocket.
It's the one in your pocket.
Yeah.
And so I live them. So I'm using it all the time to, if someone has one, I want to look at the data. And people are genuinely surprised because I thought it was like nonsense. And you're like, no, it's not nonsense. Because it can save you hours of, okay, let's come do this test. Okay, let's do another one. To the extent where we used to use quite frequently implantable monitors because we were trying to detect things that are quite rare. And
so that's an invasive test. You're putting something in around the heart.
And, they've got smaller, but, it's invasive. Whereas now you can detect disease quite easily with wearables. And what I also think is important is you can monitor disease. So I have a lot of patients with atrial fibrillation, clearly, because that's what I spend most of my time doing. And there are a variety of ways in which you can treat people with AF. So if they have a wearable, people are always saying, oh, why do I get AF? And they always sort of think, what was the last bad thing that I did? They've decided what's bad.
Yeah.
Okay. And they'll go, oh, that's easy. If I just stop doing that one bad thing, I'm going to be okay.
Yeah. I had a steak and kidney pie.
Yeah. It doesn't work like that.
No.
As you've just heard from Sanjay, why do people sort of suddenly drop down dead? And it's not just one thing, it's several things. But if you have a wearable and you're tracking your amount of AF, it might help you to go, oh, actually, I always get AF on a Friday, but on a Thursday, I'm always going out to the pub. It's all, I always go for a run first thing in the morning, etc., etc. So it allows you, hopefully, to maybe modify behavior or to recognize your triggers. Also, you can monitor the response to treatment. So I can give someone an antiarrhythmic drug and you can see, is it effective or is it not effective? If it's effective, we know that 40% of the time within a year it's going to be ineffective. So you can track when that happens. If you're not on drugs, you can detect when it's getting worse. And then you can go, right, well, now it's probably time that we step up treatment.
And intervene, yeah.
So there's detection and then there's monitoring.
So they have a real active role in telehealth and remote monitoring for managing heart disease.
Yeah. I actually get lots of my patients to buy a device because then I can give them medication that they take in an emergency. And, you can say, right, phone me up, send me the data. So then, it's like a virtual hospital. I've got the ECG. I also know they've got medication. And I can then go, right, you should take this one rather than that one.
Yeah.
They're very good for things. And I was going to say that, in the long run, they save an individual a lot of money. If we look at things like Zio patches are very expensive.
What is a Zio patch?
It's basically an adhesive, leadless, waterproof monitor with a 2-week battery.
And where do you stick it?
Normally just around the sternal area on either side of the sternum.
Okay, so on the chest.
Yeah, and it's not very visible. You can wear a shirt over it, a t-shirt. It's not sticking out, but it's got a 2-week battery. And clearly, you keep a diary. You shouldn't be. You can't. They don't work in water. They come off. So you should.
Sweating even then is a
So
challenge.
they're okay with sweating.
Okay.
They've worked well in some of our sports people. You can't swim with them or have a hot bath with them. You can shower. But, they're as good as someone's symptoms. And they're expensive in the private sector. So if someone comes to see you in the private sector, because that's where they're available mainly, they're expensive. And you can have one Zio patch after another, and still not identify the arrhythmia.
Right.
But obviously you've got this watch at home. And I certainly do recommend that people either purchase a watch, £400, £500, or another heart rhythm monitoring device, because in the long run, that will save them a lot of money. And as Matt says, you've got this little contract with them, a friendly one, not financial one, where they send you a link when it happens. You say, there you go, we've got the diagnosis. Yeah. Then obviously, if it's something that's nothing to worry about, that's fine. But if it's something that's, now so many of these arrhythmias are curable, and I've sent Matt and some of my colleagues so many athletes where they actually fixed them. So they're completely fixed. And yet that wasn't going to the cardiologist again and again and again, drawing blanks. Yeah. You found you got the symptom, sent that diagnosis over. We made the diagnosis. We dealt with the arrhythmia.
I mean, I was a cardiology house officer 20 years ago. And it's fascinating to hear you both talking, because clearly these have made a revolutionary change for people with, particularly for any kind of electrical pathway disease.
Like most things, I think it's a choice. I just want the data. As long as you can take an ECG, which is a heart rhythm trace, an electrical trace, because there's different qualities of data. You can measure heart rate very easily with what we said, PPG. But what I want as an electrophysiologist, I want to see the electrical trace. And, once I see the trace, I can tell you what it is.
I think when it comes to preventive cardiology, a lot of the devices have got the vital parameters that we need, heart rate variability, oxygen saturation. And so I think in that, sleep pattern, sleep duration. So we've got all that. So physical activity steps. So I think most gadgets have got these features on them.
Thank you. Matt, what reading should give people reassurance, and which ones should prompt review? When should they go see a cardiologist?
So the easiest way, if you're feeling well.
Yeah.
If you're feeling well and you're getting an alert, don't think that the alert is wrong.
Yeah.
That's like the highest priority. If you're feeling well and you have one alert, then who knows what that means? Like, for an expert to look at the information, it would be very easy to tell, but you certainly shouldn't be anxious about it. If you're getting repeated alerts, then you need to take notice, because the more data that these devices are collecting, the more times that they think there's a problem, the more likely they are to be wrong. Like, we have about 100,000 heartbeats a day.
Yeah.
That is a lot of data to process. Now, if you're, having alerts every single day, it's pretty likely you've got a problem. And as Sanjay says, some of these sort of hidden killers, we can actually alter the prognosis for. So,
Or you can cure some of them.
we can definitely cure a lot of them. So, the device is really the witness. It's not the judge.
Yeah.
You just need the right information.
Perfect. No, thank you. Are there any common problems you see with the wearables?
It's not really a problem with the wearable itself. The problem is with the interpretation of the data.
Okay.
So I think the only downside that I see is that you can induce anxiety in people because they think my number is the wrong number. And one of the things that I'm constantly saying in lectures and to medical students and to doctors and GPs is, don't look at the number. You've got to look at the patient. And we have normal ranges which are there to avoid mistakes. But it doesn't mean that if you're outside of the normal range, that you've got a problem. Like, all of Sanjay's patients are going to be outside of the normal range. They're going to have a sinus bradycardia.
I operated on an elite athlete the other day, and their resting pulse was about 29, and it kept setting off the anesthetic machine. And that's completely normal for that patient. So yeah, that can be the case.
I think the other thing is noise.
Yeah.
So obviously, when someone's panting, or they've got they're making a move, they're cycling hard up a hill. Sometimes the rubbing of the garment can sometimes create noise, and the algorithm will say mainly sinus rhythm and 15% other. And obviously that causes a lot of concern. What was this other rhythm?
Yeah.
So there again, you've got to interpret that it was just noise, and it wasn't abnormal beats. Sometimes it may misinterpret some noise as a supraventricular extrasystole. But I think that's the main problem in sporting individuals, noise, when they're doing something very, very vigorous.
And with noise, you get that in medical devices as well.
Yeah.
In textbooks of medicine and in daily practice, you'll get called to telemetry. So when someone's being monitored whilst they're in hospital and everyone's all worried, and you're like going, the patient's brushing their teeth, and they've got an abnormal rhythm. But if you look through it, if you look through the noise, you can say they're in normal rhythm.
Yeah.
But you can't, or the shivering, the cold.
Yeah.
Or they've got Parkinson's and the shivering, or they've got a tremor, and the alert goes off, even on medical devices. So. But we can understand that. Like, we've been trained to look at ECGs. That's all I do.
To interpret it and translate it.
And so this is where the issue is. But the problem isn't the data. It's not the wearable. It's the interpretation of the data.
Sanjay, zooming out to heart health beyond the technology, can you just talk about lifestyle fundamentals, just to round things up? Exercise, sleep, stress, anything you want to add?
Yeah, I think obviously being a cardiologist, I'm going to focus predominantly around cardiology. As I said at the very onset of the interview, that at least 70% of all causes of cardiovascular disease are modifiable, and that includes physical activity. I was reading only recently that even now 25% of the British population is completely sedentary. I was reading that around 60% of the British population has got a BMI of approaching 30, which surprised me a lot. And I was reading that, which this bit didn't surprise me, that 1 in 3 people aged over 40 have got high blood pressure. Yeah. So obviously in these situations, I believe physical activity, curbing your alcohol consumption, sleeping properly are really important modifiable risk factors that you've got control of. I'm not going to go into smoking. That's something that's well known. Clearly, people shouldn't smoke. And the only thing that none of these things factor in our devices is in terms of predicting. For example, when we look at charts like Q-risk score, and we use these Q-risk scores to say, you need to go on a statin, you need to be on a high...
What are your chances of having a heart attack over the next few years?
None of them factor in stress, and none of them factor in functional capacity. Yeah. And functional capacity, if you've got a high functional capacity and you don't endure a lot of stress, then you're going to do well. Yeah. And making it very lighthearted at the end, happiness. No one factors in happiness. Yeah. So generally, it's well known that people who are depressed and miserable, people who don't exercise, people who are stressed out, and people who are not fit generally do badly. So I think there are lots of things that people need to take on board from this podcast.
Yeah. And so social networks, interpersonal relationships come into this as well, don't they?
Very much so, yeah.
How should people think about heart health as they age?
Well, the prevalence of cardiovascular disease increases exponentially in your 7th decade, and you've got to prepare for that. Obviously, you've got to make sure that you're in good shape before you get there.
Yeah.
And I think preparing for heart health starts from the very, very beginning. You know, you've got to monitor your habits. We know the major risk factors for coronary artery disease.
As you discussed,
So cigarette smoking, I think inhalation agents cause harm.
Yeah, even vaping.
Even vaping. Clearly, we can't measure blood pressure without wearables or lipid profiles. But I think anybody that's got a family history of premature cardiovascular disease or sudden cardiac death should actually have their lipid profile checked, their glycemic control checked, and monitor their blood pressure. So I think as far as heart health goes, you need to learn to look after yourself from day one, staying fit, monitoring what you eat, minimizing the intake of your saturated fats and your fried foods, and increasing your oily food and your oily fish is good. So good diet, good physical activity, not smoking, staying slim are probably the
key
4
ones.
things.
Are there any supplements that cardiologists recommend? You mentioned fish, omega-3 oils, fish oils, things. Are these kind of things that have any kind of scientific backing to them?
I personally feel it's all in your diet.
Yeah.
So I don't necessarily prescribe to supplements.
Yeah.
Clearly, a lot of the athletes I know take them. A lot of doctors take them. I think the one thing that we all agree is that vitamin D deficiency is associated with lots of problems, including cardiovascular disease.
Yeah, and so many musculoskeletal.
Yeah, and so many pigmented people in this country rely on much more sun to create vitamin D. So that's one thing I do.
Yeah.
So I do promote taking vitamin D and getting a vitamin D level checked.
Yeah.
To ensure that you're in good shape.
As a pigmented person, I take them too. Thank you both. This has been a clear, grounded conversation in an area that's often overhyped or misunderstood. Wearables aren't a replacement for clinical care, but used properly, they can be a powerful tool for awareness and early detection. I'm going to hide my iPhone from Matt. You've been listening to Exploring Health with Cleveland Clinic London. I'm your host, Kash Akhtar, and it's been a pleasure to speak with Sanjay and with Matt. If you've been listening or watching and you want to take care of your health, check out the link in the show notes, and you can find out more on the Cleveland Clinic London website. And if you found this episode valuable, please subscribe, leave a review, and share it with someone who needs to hear it. Until next time.